Dining out can occasionally incur hidden fees. Perhaps before going to dinner, you didn't account for what it might cost to check your coat. Extra cheese might sound pretty good, but nope, that's not included with the price. And once the bill arrives, of course, you've got to cough up an extra 4% for your server's health insurance. Huh?
People who walked in the door and said, hey, I hear what you're doing for your employees. I've worked in the restaurant industry and we never had health insurance.
That's JenChan, the owner of JenChan's, and she's talking about an interesting innovation she's brought to a restaurant in Atlanta. And no, not her menu's mashup of Chinese food and pizza, but instead offering her full-time employees health insurance. According to this 2019 report from Restaurant Dive, only 31% of the restaurants they surveyed offered up its employees health insurance. Now at this place in Atlanta, the full-timers get access to medical insurance. But just recently, after their healthcare premiums tripled, the restaurant started tacking on a 4% health insurance fee to its bills.
This year it covered every single thing, and it was $2,000 off, which means that 4% is just like, it's almost the perfect amount of money to cover everyone's premiums.
Now this insurance surcharge isn't some completely hidden restaurant fee, like finding out that second basket of chips and salsa isn't on the house. Not only have they got signs everywhere, on the menus, and on the receipts letting customers know that they're being asked to pay to keep the people who are serving them food not to be sick, they even offer up the chance to opt out if a customer doesn't want to pay it.
We feel like there's a pretty huge crisis going on with health insurance. No one can afford it, and nothing has worked.
This bartender with a joint, who's been there a year, didn't have health insurance before taking this job.
I don't have money like that, and so I was just kind of like living my life without it.
But some customers aren't happy they're being charged extra to provide employees with basic access to healthcare benefits. Unlike in countries like Canada, France, the United Kingdom, Sweden, Switzerland, Germany, Iceland, Israel, Hong Kong, and Italy, which have all been giving its citizens universal healthcare for decades. Some out-of-town guests, perhaps not visiting from these more generous nations, have even left the restaurant threatening messages like these. I've never seen a family that needs to be beaten up more make that healthcare come in handy. And our bartender here recalls someone who was especially miffed over being charged a 4% fee that amounted to a whopping $2.
They ate food here, dined in, said nothing while they were here.
Keep in mind that the infatuation just named this place to be one of Atlanta's best brunch restaurants. Yet still, some have been going to Facebook to write things like, that 4% for your insurance? Well, I'll keep the remaining 16% to pay for my insurance, which seems to imply they won't be leaving a 20% tip. I don't know, people are weird about tipping. But as another Facebook user wrote, wish every business had a healthcare is still broken in America fee. Now the bulk of the most recent comments on JenChan's Facebook page have been positive, and the restaurant even recently wrote to thank people who reached out to show support, or even took the time to email them constructive dialogue. While the owner doesn't appear to be ready to walk back this policy,
Not changing a thing.
she hopes that our nation's government will do something to improve the cost of healthcare for its citizens.
The only thing I hope that we can change is if Congress does something, then I can just take that line item off completely and not even worry about it.
Now, for those who still balk at the idea of coughing up an extra $2 so a waiter can get access to an MRI if they need it, it's worth pointing out that an independent report from last January found that not only does the USA spend more money than peer nations on its healthcare system, and is the only high-income country that doesn't guarantee healthcare coverage, our health outcomes are also far worse, with an above-average avoidable death rate and the highest rate of infant and maternal deaths compared to other similar countries. Anyway, enjoy your meal.